Okay, now we're going to talk about epidemiology in the history and how it developed. So here are our course objectives, and you can read those. Okay, so what is epidemiology? This is the formal definition taken from the Dictionary of Epidemiology, but is a bit complicated, so we're going to break it down. Okay, so what does this mean? To discover the cause of an illness in a population and use that knowledge to protect the health of the community. It means to find out what is making someone or a group of people sick and take action to prevent the illness from spreading with either medication, vaccinations, public education, or isolation. Examples of this include the flu vaccine, because we're preventing people from getting the flu, boil water notices when we know that something's contaminated our water, evaluating and assessing TB patients, whether it be, healthcare workers, to give them a test to see if they have been exposed, or people who have active disease and if they're going to get management from it with medication. And then Cipro during an anthrax attack, that would certainly be an example of what this means as well. There are many fields in the study of epidemiology, including the ones listed here. Examples include testing beach water and closing the beach if people become sick after swimming there, warning people to wear sunscreen to reduce the risk of skin cancer. These are some of the types of epidemiology that we're going to be talking about. As you can see, epidemiology is not restricted to infectious diseases, which is what our epidemiology department primarily deals with. Many of the decisions that you make in your everyday life have been influenced by the work of epidemiologists. And you can see some of the things that have happened in the history of epidemiology here in this slide. Okay, so let's talk about how epidemiology was developed. In the 1850s, there was a cholera epidemic in London. Scientists hadn't figured out that microorganisms cause disease, and they blamed the spread of disease on bad smells in the air. John Snow had a theory that sewage-contaminated water was causing the cholera epidemic, and he designed an investigation to prove his theory. John Snow went door to door and talked to families about the source of their drinking water and about whether there had been illnesses in the household. He soon learned that nearly all cases of cholera occurred in people who lived near the Broad Street water pump. John Snow identified a handful of cholera cases near a different water pump, but he soon learned that these people drank from the Broad Street pump as well. Some drank from the pump because they even preferred the taste. John Snow went to authorities and told them he'd discovered the source of the epidemic. The authorities were initially reluctant to believe him, but they decided to remove the handle from the pump as an experiment, and as soon as they did, the cholera epidemic stopped. Okay, so let's talk about the epidemiologic functions. Public health surveillance is the ongoing collection and analysis, interpretation, and distribution of health data to help guide public health decisions making and action. Surveillance is equivalent to monitoring the pulse of the community, and it provides the information for action. One of these actions is an investigation, which can range from a phone call to an extensive coordinated effort to identify the cause of an illness. Sometimes it's necessary to determine the relationship between the exposure and the adverse health event using data analysis methods. This may lead not only to appropriate interventions, but also to advancing in knowledge about the cause of the disease. Communication of the results can be both written and verbal through reports and presentations. Collecting the data does nothing for the general public unless the results can be clearly communicated. So that's why communication is very important. Here are some key terms that you're going to see while learning about epidemiology. Risk. Risk can be categorized into high, low, and sometimes medium. An example, your risk of getting infected with HIV after a needle stick is less than 0.3% as a healthcare worker. A case is the person who is sick. Incidence is the total number of people who become sick during a specified time, like between March 1st and March 31st for the entire month. Prevalence is the total number of people who are sick during a given time, including those who became sick and were already sick. And we're going to go over some of this stuff later on as well. There's a couple of more terms that you're going to see during this course. What is endemic? Endemic is something when it's constantly present in the population. It's normal in this population. For instance, some example of endemic illnesses are salmonella, lead poisoning, and hepatitis. We see these all the time in this country. There are many endemic illnesses that we might see in other parts of the world. For instance, malaria. There are some parts of Africa where malaria is endemic, but it's rare that we'll see it in this country. Some examples of non-endemic are hantavirus, Ebola, and typhoid fever. We rarely see these in this country. So if we have just one case of the disease, it is considered an outbreak. This is really an important concept that you have to get. If there is an illness, a disease, that we have one case of, but we usually do not see it in this country, that is considered an outbreak. Okay, so on the previous slide, we talked about outbreak. Well, an epidemic is essentially the same as an outbreak, except for how much area it covers. If a disease begins here and then moves throughout the state, we would consider it an epidemic. It becomes more difficult to control and requires a much larger manpower of effort to contain. On the other hand, a pandemic is when the disease spreads beyond the borders of our country and may even spread to other continents. An example of this is the flu epidemic of 1918-1919, which lasted 2 years and killed between 30 and 40 million people worldwide. The H1N1 was also considered a pandemic as well, because we saw it in other countries beyond our borders. This is a picture of that pandemic I was just telling you about during the 1918 and 1919 for influenza patients. All of the regular hospitals were already overcrowded, so tent hospitals were established. The effects of the influenza pandemic were so severe that it reduced the average lifespan in the U.S. at the time by 10 years. Okay, so here's a couple of more key terms that you'll need to know about. Incubation period. It's the time between the initial infection and when the first symptom begins. Many illnesses do not make you immediately start coughing or sneezing or vomiting as soon as you become infected. It takes a few days for the virus or bacteria to grow in your body to a point where your symptoms begin. For example, it takes an average of 12 to 36 hours for most foodborne pathogens to make you sick. So if you have food poisoning symptoms, vomiting, diarrhea, stomach cramps, the most likely culprit was from something you ate the day before, not the very last thing you ate. We use incubation period to help us identify a disease. Now, the mode of transmission is how the illness spreads through the community. This can be food, air, water, or contact. And when we find out the mode of transmission, we use this for prevention strategies. Boy, I guess we sure do have a lot of key terms in this unit. What is prophylaxis? Prophylaxis is given to people with no symptoms. Example, the flu shot for the person who doesn't have the flu. When they had the anthrax scare in the post office many years ago, they provided Cipro to those people that worked within that specific area. Meningitis, pneumococcal is recommended for kids that are starting college. So this is given prophylactically so they will not get it. Isolation. We use isolation when someone has a highly infectious and deadly disease easily spread through the air. Then we do not want that person walking around in the community. The person is isolated in the hospital or at home. Example of such diseases are TB, and I'm sure that you all have had some experience with TB in the hospital, and SARS as well. They isolated and actually restricted people from traveling when the SARS outbreak occurred. The Department of Health has the authority to restrict a person's movements for the well-being of the community. This may include locking them up if they do not adhere to isolation rules. Some people feel that isolating is against their civil rights. And then we also want to talk about quarantine. Quarantine is more difficult to enforce. A quarantine involves restricting the movement of people with no symptoms who may have been infected. The Department of Health, once again, has the authority to do this. And I know that I have heard in history in healthcare that they used to quarantine families if a child developed something as simple as measles. It's a picture of a building that was used for isolation of smallpox patients in New York City. They were sent to the hospital on an island with nothing else on it to prevent them from coming in contact with well persons. Imagine if they did that today. So we'll end this presentation with community partners. And these are all the people that are involved as community partners. At the Pinellas County Health Department, the epidemiologists cannot work alone. They must maintain working relationships with various agencies to support the work they do.